Welcome, David. This is great to have you on the Master AI Disruption podcast. My pleasure to have you here. We had a fantastic pre-chat, and I'm really looking forward to diving deeper into your insights today. So why don't you tell us about your company, which is Senior Health Insurance Advisors, which you created, founded, and are the leader, the CEO of, and you're based in Massachusetts. So the floor is yours. Tell us
All
a
right.
bit for our listeners, your story of origin, how you got here, and we'll take it from there. Thank you.
Yeah, I appreciate you having me. Thank you very much. So yeah, my story is I had been working for a payroll company actually for 19 years, and during that time they also had agreed to let me sell health insurance. So I sold health insurance and payroll for a number of years. Probably about 8 years ago, I had approached the head of benefits and said, I think we should, sell Medicare because I had lost one client, didn't lose many clients. So I just inquired as why I lost them. And they said, oh, we had somebody come in, they helped us with the Medicare, they wanted to do the insurance. I thought nothing of it. And then I lost another group about a month later for the same exact reason. So I said, I think I really should look at this. And it turns out that 10,000 people a day here in the United States are turning 65 from now until 2030. And I figured that it would be not only tremendous opportunity, but it was going to be something that all businesses and individuals are going to have to deal with. So dove head first into the Medicare um, company I was working for. Had a bunch of questions, so they would filter them to me. And then that company sold, and eventually I just veered off, and I'm standalone now. So we specialize in Medicare, but we also do individual health insurance under 65, dental, vision, all the ancillary stuff, and still help some small businesses as well.
And if I may add, David, I was really impressed by the fact that you are also certified, it's extensive licensing across 19 states, and also your upcoming CMIP certification, right? Or it's already acquired, or
Yeah, no, that's already there. And I also am a National Social Security Advisor certificate holder. So had that for a couple years. When I first started the business, I got asked a lot of Social Security questions and thought it'd probably be good if I can answer some of these questions. So I
wonderful.
pursued that and so I can help people out and answer their questions. I'm by no means an expert, which is what I tell them, but I can help guide them if they have questions, and they usually do.
Okay, well, besides this exceptional commitment, to your expertise, I bow to you. Is there anything that you'd like to share about the scale of your operations or any key metrics that you're proud of that you achieved?
Yeah, I mean, I would say 7, 8 years in the business. We have just under 1,000 individual health contracts. Now, those vary drastically. Usually, most people have multiple, different lines with us, whether it's dental or a supplement and a drug plan and individual plan. So we run the gamut there. But the core business is got a good 5 to 600 people. We're still growing, obviously. We're nowhere near where we want to be. We want to, double if we can in the next 3 to 4 years. And what we're hoping to do is, and what we've been fortunate to do is leverage technology in that, to not only service our clients, but also, streamline our enrollments, our renewals, and all those things.
Got it. Wonderful. All right. I love the ambition. So yeah, it's a lot of contracts to manage for sure. So would you like to share maybe a few of your perspectives or insights around the industry trends, what you see happen in that particular niche that you're in, and maybe broader if you would like to?
Yeah, so Medicare has been kind of an up and down industry in the last 2 years. A lot's changed. It's highly coordinated with the federal government and how they reimburse the insurance carriers.
Hmm.
And then there's the multiple product lines. People can either stay on original Medicare and get a supplement plan, or they can utilize the Medicare Advantage plans, which they do to a large degree. You've had people now, carriers now enter. certain areas of the country, leave certain areas of the country. We're dealing with some carriers that, might have non-commission plans, there's commission plans. So there's a lot of variables going on, a lot of up and downs. Um, the funding for Medicare has kind of gone up and down last year. Um, they increased it this year so far. That might not be an option. Hopefully it will be. But all that directly affects all of my and our clients out there. So, the less money the plans tend to strip benefits, they tend to leave service areas. They don't offer as many ancillary benefits as they used to. The drug coverage has changed dramatically. There's now a cap of $2,000, but the cost has also been absorbed by some of the people that aren't reaching $2,000. So I would say within the last 2 years, especially 2025, 2026, 2024, there's been a lot of change, and I anticipate there'll be some more change here in the next year or two. But it's changed a lot. When I first came in, you would have people put on plans and they just would stay with plans for years because the plans didn't change that much.
Mm-hmm.
Now, because networks change, prescriptions change, formularies change, now it's a lot more important for people on those plans to kind of make sure, hey, was plan I had this year good for me the following year?
I get it. I get it. So then you're starting to say something about it. So let's expand on how these trends impact independent agents like yours and smaller firms like senior health insurance advisors, and are there any specific challenges or opportunities that stand out according to you?
Yeah, well, the biggest challenge is that if you have more people reviewing their plans, which you've had in the last 2 years, and what you'll probably have in the future, it's more demanding as your clientele number increases because obviously we all want to grow our businesses, but at the same time, we need to retain our businesses as well. So that makes the annual enrollment period from October 15th to December 7th a extremely busy time,
Yeah.
usually nonstop. Um, and you're just seeing more and more of the plan changes and people having to review things. And that's kind of extended out to the open enrollment period as well.
Mhm.
So you'll see a lot of networks fall off, or there might be changes. That gives people in a Medicare Advantage plan the ability to make changes to their plans to adjust to that. But I would say the number one challenge is the fact that more and more people are reviewing plans, and you have to spend more and more time to retention and less time to growth. And you really need to have good systems in place to make sure that you can divvy up that time properly.
Hmm. So that's how you anticipate, to deal with those. That's how you prepare to deal with the changes that you anticipate are not going to go any lesser.
Not for a couple of years, I don't think. They keep saying, they run in, 2, 3 year cycles, but I don't know. I don't know that it'll change. Then again, I don't have a crystal ball. I can tell you anyone that says they definitively know is not being completely honest because I don't think anybody knows exactly where we'll be 2 years from now or 3 years from now.
Mhm. I get it. I
I
get
can tell you where I hope to be and where I'm sure many of my fellow brokers hope to be, but who knows where we will end up.
That's a perfect segue for my next question, which is, so every successful business owner like you has a next level, right? That they're striving for. So for senior health insurance advisors and South Shore Medicare and health insurance advisors, what does that next level look like for you? Let's say in the coming 1 to 3 years. Yes, as you were saying, by the way. Yeah.
So what does that look like for me? That looks like for me is that I continue to expand the brand. I think that's the most important thing. We streamline all our services in terms of the way that we service our clients. I
Hmm.
mean, one of the things that COVID actually brought on in our industry is used to be a very heavy paper face-to-face industry, but the ability to now do a lot of that stuff, still follow all the compliance rules, which is important, extremely important in our industry because there's a lot of them, but technology's allowed us to, streamline all those compliance rules, enroll people, have meetings like we're having right now on Zoom. More and more people are becoming used to Zoom. More and more we can sign these contracts and get them done electronically, those enrollments. So that helps a lot.
Mhm.
Um, the nice thing is the 65-year-olds that come into the marketplace every year in terms of the Medicare are becoming, they're obviously more and more technical savvy. So that helps kind of streamline things. So where I hope to be is can continue to, build the brand. I have a physical location here in Massachusetts. We're in Hanover, Mass, and I have an office that's 3 doors down from Social Security. So, that gives us a lot of foot traffic. But also, we're trying to reach out as much as we can locally in the community. But, hey, we can spread out. Like you said, we're in 19 different states. So, and we know our surrounding states very well, along with the southern states really well.
Mm. Mhm. Do you see any other levers of opportunities or opportunities for you to expand and to reach your next level?
Yeah, well, obviously AI is right there. So, the question is learning what tools can be valuable, short of looking it up. It's going to be streamlining and making sure that there's a process and hopefully maybe AI can help guide us through, less without the need of manual work. And by
Mm.
manual work, I mean the ability to potentially have errors. Anytime there's manual work, you
Sure.
have the potential for errors. So, I mean, I think the opportunity, I think it's an adjustment, quite honestly. Like owning a business is constant problem solving and constant adaptation. And if you can't do those two things, it's really hard to stay relevant and even afloat. So for us, the challenge is going to be being adaptive, being creative, and being able to adjust as the industry adjusts.
Hmm. 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 So now one question. If you had a magic wand, what would be the one biggest challenge that you would like to see out of the way?
Oh, I would like the government to tell us exactly how much they're going to fund the insurance companies so that we can adjust to that. That's where, if we knew that number years in ahead, that would probably be the biggest thing. By the way, if you asked any of the carriers that, they'd probably nod their heads and say, "Yeah, we'd like to know what those reimbursements going to be." I mean, that dictates a lot of what happens. It's a trickle down effect in our industry. So if I had a magic wand, I'd say, hey, can you give me an idea of what the next couple of years are going to look like and what that those reimbursements are going to look like?
Mm. Mhm. So because that's not possible, obviously, to remove that disruption, right? What would be something that you like to change um, to be better, not prepared, positioned? I don't know if it's prepared,
Yeah.
okay. Positioned for disruption, because could we ever be prepared for disruption? I'm not sure,
Yeah.
but what would be for you the dream scenario within this disruption, which is probably here to stay, as you were saying at the beginning. You don't see anything radically changing from what it is today in the next 2 to 3 years.
So I would say, what would I like to have the most is just make sure that our knowledge of exactly what networks go together with what areas of even the state and what carriers work with what networks, making sure we're really good there. We're making sure we're really good at understanding what prescriptions are going to cause our clients problems and being proactively prepared as formularies and stuff change. It's just going to be really demanding that we really know what all the carriers offer and what all their plans offer inside and out.
Hmm.
Because the nuance of those plans is really where we're going to be able to put people in the correct position for them. It's a
Sure.
very individual thing, Medicare. A husband and wife, maybe they for years have shared the same plan. They have two drastic different providers, prescriptions, health issues that they're dealing with. One might be dealing with very minimal. one might be dealing with a significant amount. See that all the time.
Hmm.
Um, so really, it's going to be making sure we're in the weeds. We know what products are out there. We know the nuance of those products, and we're making sure that we're um, getting enough from our clients to make sure that we're putting them in an optimal place. If we can do that, we'll be okay because we'll continue to expand. People will be happy with the service. They'll be happy with the plans that they have, and they'll have the protection they need along with the benefits to offset it.
Got it. Yeah, makes sense. Another question, we didn't really discuss client acquisition. We discussed with retention, right? The difficulty in that new environment where people check more their policies and go more into details. So how do you currently approach client acquisition and especially for small group health plans? And are there any aspects of that process that you might have in place that you find particularly challenging or time consuming?
Yeah, so I would say that in terms of growth, what we try and do is um, network with affiliates. So we work a lot with financial advisors.
Mm,
That's a primary focus for us. The advisors don't get into the weeds in Medicare. They're dealing with life insurance, long-term care, annuities, whatever it may be. Those are things we do not do. We specialize in our niche, so we can be a resource for them. And the fact that we can do under 65 enables us to handle the 58 to 64-year-olds who are retiring early, don't have access to Medicare. They want to know what their health costs are. That's a great area for us. But so financial advisors, the other thing we do is we try and reach out to companies that have demographics of in not only aging population, but quite honestly, a younger population that's taking care of aging parents. Because not only do people that are retiring and the baby boomers need some education on Medicare and resources, but quite honestly, the people that are younger working for companies like our education as well because they don't understand and they're helping their parents navigate.
mm,
So companies, larger companies, ideally are a target of ours. Um, Obviously, we get a lot of referrals from our clientele. We want to make sure that experience from end to end is smooth, good, they're comfortable. Is they're going to tell their friends and their family about us. Um, those are the main areas. I think the other important thing for us is to expand locally. We advertise in local magazines. I've done a few radio shows, podcasts like these, really expanding the brand. I mean, obviously, the number one threat to any business is if they don't know about you, then how can they come to you and get your services? So I think for us, also expanding that, making sure we're out there, be a little more proactive in social media. Um, and again, affiliates with even estate planners and other people that are within that age demographic that we are searching for.
Then lastly, because you're talking about brand awareness, etc. So obviously you're in a competitive market, right? So do you encounter sometimes, often, rarely, people who say, well, love your company and thank you for making the offer you made, but actually I chose a competitor. Do you hear this sometimes, or people leaving for competition?
Yeah, I mean, you're gonna have attrition, and you're gonna have people that go in other directions, and that's fine. I mean, that happens. That's the nature of the business.
Mhm.
And they might go see, oh, I talked to this person, or I went down to, maybe one of the Shine centers. They told me to do this. I already switched my plan. I made a decision. That's just part of the process that we go through. So we see it. There's a lot more stuff out there that competes with us. But as long as we're doing a good job, we'll be fine.
Hmm. And have you encountered competitors that have things that you don't have in place, such as AI systems or things like this, or not so much yet?
I mean, listen, we don't have the huge volume that maybe some of the competitors do that are national, and they probably have some tech that we don't have access to, or AI tools that we may not have access to. But it's still a demographic that, quite honestly, um, wants person-to-person touch.
Yes.
So they don't want to get away from that. That's why I have a physical location. You would be, you know,
Right.
we've had, I think we opened in March of 2025, and within 10 months now, going on 10, 11 months, we've had well over 160 walk-ins.
How
So
many? How many?
over 160.
Wow.
All right. So about a third of that turns into clients. About a third of that said, okay, we'll come back during the annual enrollment period. And listen, the other third is just kind of just looking for information. Can you help me with this? It's things that they ultimately won't be a client, but we help them out. That helps get us traffic as well. Um, and one of the things I will say is we do get a lot is when they come in, they're like, it's really nice to talk to somebody about this stuff face to face and
So, of
and
course.
and get that. Now, obviously, that's local. Where we're doing, have our clients all over. Can't do the same thing. That's where Zoom comes in. But yeah, we feel like that is kind of our niche and where we're unique.
Wonderful. Well, thank you very much for all these insights. I think it's been incredibly rich, for our audience. I really thank you so much, David. Any two words that you would like to add or?
No, all I would like to say is if anybody or anybody that's listened to this would like some help, my website is shiadvisors.com. You can go to our website. You can see all carriers in all the different states that we cover. If you're in Massachusetts, we'd obviously love to talk to you. We're well versed in all the plans there, but also all of New England. And I'd be happy to be a resource for anybody, financial advisor, health insurance broker, HR person. Would love to talk to them, especially.
Wonderful. So we all have aging parents, so do reach out to Senior Health Insurance Advisors, David Dupuy, the website being shiadvisors.com. David services many states in America, more than a third of them, if not half of them. So do inquire. David, when we had our, preparation meeting, you also mentioned healthcare brokers. Do you want to say a few words about that?
Yeah, that's another segment that we partner with. Now, I've spent over 15 years selling group health insurance, and I know it gets brought up a lot. I mean, I talked about my origin, getting into Medicare, but we're also a great resource for them. We work closely with a lot of them. Very appreciative of the relationships that I have with a number of them. But large group, small group, doesn't matter, especially a large group, though. A lot of people have questions, they need some help. Executives are coming off plans. So, health insurance brokers are a great partner of ours. We hold their hands in their clients' hands. So we hope to reflect well. We often do, reflect well in terms of their brand. So those are people that we love to talk to as well. It's one of our main core building blocks.
Wonderful. Well, I think it's a good place to end. This is a huge market for you, and I can only wish you well with that segment as well. David, thank you. Thank you to our audience. It was a pleasure to have you, and this is the end of our podcast. Thank you, David.
Great. Thank you for having me. Very much appreciated.
You're very welcome.